Now I'm Sunil Shah with me. My wife Sumita is there. I just wanted to share my excellent experience and a journey which I had here. But before that, I want to tell you that how did I land up here. I, in fact, had been facing some gastric issues for last couple of years. Immediately after food, I'll have a pain on the right hand side above the ribs. And generally after lunch, I will go out for meetings and all and driving. So I used to always feel some pain is there. I'll keep stretching myself like this and think that it's a gastric pain. I had been taking medications, but probably missed out doing the ultrasound. And a year back, I think a period of 1.5 months, I had 2 episodes of severe pain at night. So the first time when I had it, I was in Haridwar in a very nice mood of doing pilgrimage. And I was already knowing that fatty food is sometimes creates a problem with the digestion, but couldn't stop myself. Had a thick glass of lassi with a huge cream on it, and the same very night I had this pain. So first time when I had a pain, and one of the experienced family member, my sister who lives in US, she is also from the paramedic background. So she said this pain indicates there's something wrong with your gallbladder, because if it has lasted for over night for so many hours, so please get it checked. So moment I was relieved, I ignored it again. But then second time when it happened after a month or so again, then I got my ultrasound done and I went to a gastroenterologist and they checked first. They were doubting some infection and all, normal stomach infection. But it was there, but parallelly there was also this symptoms he recognizes it better do an ultrasound. After ultrasound, the first thing he told is you have a stone, and the size is not too small to get stuck anywhere, but not still the right time to get that removed. But as usual, I'm basically from a biomedical background and a bit fussy about not till the time I get satisfied knowing that this is the best option. I started exploring and then come across a homeopathic doctor. And she gave me a lot of assurance that with my control on the diet, control on my eating habits like not eating late, it would be gone. So almost 8 months I had a medication, spent a huge amount of money and time. But though it was little bit, I was not so comfortable because my dad was a homeopathic practitioner. So I knew it's not that expensive, but still I was thinking if I don't have to remove a body part, I'll be good. 2 of my family doctors, family friends, they also advise, Sunil, there is no way this gallstone can go, even if some medication can dissolve it. But understand the fact that if your body has a tendency to form stone, it will again happen. So are you going to continuously get this done? But in spite of that, I did it. But my recent episode, 10-15 days back, I realized that was the 4th episode in last 1 year, some 2 months. I decided no, it was this time it was more than 10 hours of pain, almost I think 12-13 hours of pain, and again discomfort throughout the day, feeling bloated. And still I was thinking maybe this doctor did not know how to get it dissolved, let me try alternate. I went to naturopathy, but to best of my luck, they had seen the reports and they also advised the same. So I'm happy that I have a tremendous trust on naturopathy, but then they also agreed this is too large a stone, and I don't think, they also said you can do an RD test that will only tell you your body tendency. And from the history which you explained, your body has a tendency because it has grown up from 8 mm to 13 mm. It means you're constantly having this kind of deposit formation. So then I reached out to again the same family doctor. He had his brother operated, and he said, Sunil, I cannot as a doctor, I'm telling you as a family member, go there, and I know you're fussy and you're very particular about knowing technology, being a biomedical engineer, you want to know that, so go informally. I came informally here, and luckily the staff was so very cooperative. Just moment I asked something about the hospital, when was it established, they very easily connected me to the one of the owner and promoter, Anish Bansal. And when I shared that I also come from this background, he happily invited me in his cabin and explained me how this, what they are doing, talked about this 3D technique they're using. How is it different, though it's not robotic, but what difference it makes while doing a surgery. That was very impressive. I'm an engineer and I know if somebody doesn't touch those points to me, I would keep doubting. And this is maybe my mental makeup is like that. I want to be fully satisfied. So when I came here, then he referred me to Dr. Ambekar. And I think the best part which happened all this is meeting Dr. Ambekar. Very, very confident personality. I am having goosebumps talking about him. I really like him a lot. He is such a confident doctor. He knows what he's talking. He knows who will be satisfied with what information. He was already ready with everything, knowing that I have so many queries. I am doubting whether if something goes wrong. I had the courage to even ask him, if something goes wrong, is your hospital capable of or having enough infrastructure to take care? And he said, what kind of something can go wrong? He said, sometime by mistake, suppose you cut some other part of my body. Then he explained, no, we are very, very well equipped here. We have all the latest equipment. Then he showed me that whatever experiment I had been doing, you should be convinced that it was a wrong experiment. So he took me through the entire body anatomy and the physiology, that what happens, why it cannot be taken out, and what are the complications I could have developed if I delayed it further. So I think that was good enough for me to say, no more, you need to convince me. I'm going to come immediately. And I think immediately I got all the tests done, got the earliest possible date, and everything was very, very smooth. Luckily I had a moment I said I have a insurance package, and they said yes, we have a package with care, which I want to tell you that it is one of the most economic package they worked out. I won't talk about the commercials here, but then I had already done this because I last year almost taking admission in another big hospital, and it was at least 30-40% more than this, and that also made me comfortable that what can a hospital do than being more genuine than this. And he explained me that, Sunil, it's a 3D laparoscopy we are doing, but you can verify that because you are you know the subject, so we are not charging you anything special on this. We just want to ensure that people get the best treatment. So my first experience getting into the room which was given to me was like, wow, I'm on my another business trip. I think some of the best of the hotels I have stayed in, it has exceeded the standard there. Very neat and clean, very well decorated, so very motivating when you see the decor, the paintings, the washroom, everything is, you don't feel like you are in, like I was feeling 2 days I have taken a vacation off here. And when I was doing a video call to my family, they also was feeling like, yaar maze karne aaye ho idhar, yaar surgery karane aaye ho. So it was like a very good experience. And the day I was operated, two of my relative, my brother-in-law, they came here, but I was not still shifted to the ward. And by the time I was shifted to the ward, I came there freaking out on some nice food. So they were like praising, yeah, ऐसा कुछ कर सकते हैं कि कभी कभार यहाँ खाना खाने आ जाए. My wife was telling, Sunil, you know, you are always particular about hygiene and the. So I went upstairs to see their cafeteria, even went to the extent of peeping into their kitchen, and I'm so very satisfied. And it's so, I would say, delicious food and nicely served. I had seen best of the hospitals serving food on that standard steel tray with pockets for food. That itself gives me a psychological feeling you are in a hospital. And here there was a nice bone china dishes there, and it was really, really very with cutleries properly placed, with everything very nicely served. So I was telling that मेरे को ठीक हो जाने दो, मैं ये तो खाऊंगा, अभी तो मेरे को liquid food दे रहे. Today actually when I'm asked whether I'm willing to give a feedback, I was more than happy, but I again sneaked into their cafeteria. I took some pictures there. I'm going to change my terrace as well like that. Very, very motivating terrace, such a nice ambience, and very nice food lunch we had. And post lunch I made their digital team wait because I wanted to enjoy that lunch, because today doctor said you can have everything. So I had a nice food here. I want to thank the entire staff, especially I think the nursing staff was very pleasant, the way they talk, they know the subject, and everything. Like I complained that there's something feeling. Is it normal? They went 2 steps ahead, explaining this is what is normal. But still, if you want, we can keep the doctor informed. Would you want like doctor to know this, or you want to inform him? I said, yeah, just inform. I want to make sure that I'm communicating well with the doctor to tell him what I'm feeling inside. So 2 of these nurses I remember Nisha and Shivani. Amazing girls, amazing. The smile itself makes the patient feel good, and they talk on their own. You don't need to trigger them to talk to you. They will talk to you. कैसे लग रहा है sir? सब ठीक है. आज कैसे feel कर रहे हैं? Dietitian is also very nice. She also gave a good advice, and she was like wanting to understand like if I have any inhibitions eating this, or is there are some options available with them. I would like to choose any one of them. So it's like a feeling like typical hospitality industry. Like they were really taking good care, not making me feel like अभी तो operation हुआ है तो ये दलिया ही खाना है. She gave me few options. These are there. So out of this, any one you can choose. You have some restrictions, so you will have to have, but in that you have an option. And she was also educating me on some myths I had about whether this can be eaten or this can. And she said, no, let me go 1 step ahead and tell you this is a myth. You can have that. I was telling that it seems milk is not good and paneer is not good. And he said, since you have already quit non-veg, so where will you get protein from? So he said, no, you eat moderate quantities, chew them well, have gaps, don't have too much of it. Everything is good. You can digest, and post this, once you recover, I think doctor must have told you would be a normal life. So it's very good experience. I have no more words.
Explained, whatever queries, whatever doubts we had, they explained it. Explanation was so clear. So we didn't have any doubts in our mind कि इसके बाद घर पे जाके हमें कोई tension हो. Everything was well explained.
And even the small things I want to tell you, like I had seen so many surgeries my wife underwent, my mother underwent, they did stitches. Doctor at the beginning told me, no, now it is the latest technology is dermaglue, I'm going to use that. And while going, normally they put a transparent this thing what is used for cannula. I was thinking, why am I not given this? Then he explained me, because the weather is like this, so if I cover it with this, there are chances the weather is moist. So I think you don't need it, let it be. Today again I covered it, he said, remove it, man, I told you are relaxed, nothing is going wrong, I am taking care of that. Just remove it, feel free, take shower and nothing. There are some small precaution that not to rub on that cut area, otherwise everything is fine. So one area where I normally tend to take lead, because even if I am not well, is that I understand the subject well, but this time I could find he made my wife also very comfortable, and sometimes he said, hold on, your questions are over, let her ask. So she asked and he was saying, you have finished your questions, so let her ask. So I was feeling good, like sometimes it gives me feeling I'm the lead member in family, I know most of the things they have not known. So he made it very simple and very relaxed. Okay, what else you want to know? What else is bothering you? Is there anything which you want to clarify? So very good time, as if I just come to meet a friend. I shook good hand with him. I want to tell you, doctor, if you see Dr. Ambekar, I don't know what is posted on various media or various social medias, but if you see him in person, you would be motivated. He is a suited, booted guy with a very motivating voice, and where he shakes hand, even if you are lethargic, you will get up and say, hey doctor, how are you? So that's a good feeling. That's it. Thank you so much.